विघ्नहर्ता ट्रस्ट शिवाजीराव एस जोंधळे कॉलेज ऑफ फार्मसी आसनगाव presents certificate course on pharmaceutical marketing, conveyor and coordinator, Dr. Nitin Mohire sir, principal, and Mrs. Gauri Bhamare, assistant professor. References: aim and objective: to study the pharmaceutical marketing for working in the pharmaceutical industry, healthcare or related fields, to understand complex landscape of drug development, marketing and regulation with the ultimate goal of improving public health and patient outcome, to review the existing literature on pharmaceutical marketing and present the inferences. Marketing is a process that aims to meet the need of individuals and groups while making a profit. It is a social and management process that eventually helps to realize the objective of organization. Marketing is the process of delivering a product to a specific client for mutual benefit. This is true in pharmaceutical marketing as well. In pharma marketing, however, the consumer is a physician or a group of physicians who direct end users to purchase pharmaceutical items. As a result, the doctor who writes the prescription will be considered when establishing marketing strategies. As a reason, pharmaceutical marketing efforts are concentrated on persuade, persuading persuading or teaching doctors about your products. In marketing mix in pharma marketings, it is a typology for integrated attempt that consists of 10 controllable marketing variables, that is 10 P's. McCarthy's 4 core PS is product, price, place and promotion. Booms and Bittner's 3-dimensional additional PS are people, process, physical evidence to capture the peculiarities of services. 3 new PS are added: packaging, partnership, and policy, introduced herein to capture the peculiarities of integration in integrated care. Product definition: the health and social care solution offered and marketed by integrated care providers. Product consideration streamlines the business functioning. Second, price or the pricing strategy. It is the key motivator to business. In pharma industry, the pricing majorly on the value pricing approach, whereby more the R&D and the critical the diseases, the more will be the pricing considerations. Place or physical distribution. The consumers today have option of physical and online service providers. In either of the cases, the distribution mechanism is common consideration and businesses do consider the same. Promotions. The OTC products in pharma may take up the traditional path of promotion. Pharma life-saving drugs have a typical path of promotion. Promotions done through the professional sales representative, advertising, direct marketing, personal selling, public relations, sale promotions, and social media communications. People. Personnel who are both directly and indirectly involved in the interaction with patient stakeholders during the delivery, management, and organization of pharma products are referred as people. Example: physician, client staff, laboratory and medical assistants, officers and scientists, cardiologist, dentist, dietitians, nurses, paramedics, pharmacists, psychologists, radiographers, medical social workers, surgeons, and therapists are the people. Process: the operating and tracking method and mechanism through which the healthcare providers offer health and social care services, including follow ups, effectively and efficiently, are referred to as process of service. Next is physical evidence. It is a concrete element of the healthcare service offering a physical proof. Patient and stakeholders can assess a variety of tangible aspects of integrated care, ranging from personnel qualification and facility quality at healthcare location. Example: clinics, hospital and care centers, to documented evidence of good practices, example awards, patient testimonies, leaflets, media, publication, signage, and websites. When the professional sales representative reach the physician, this physical evidence in the form of catalog leaflet supports the physicians for prescribing the medicines. Packaging supports the protection of product and at the same time supports in promoting and sustaining good health. Partnership in healthcare sector and pharma world entails experts and institutions working together to supply, administer, and organize the health and social care solution in order to provide healthcare. Policy intent that the controls the formation of partnership and the development of processes in healthcare. Policies are approved by an integrated care board or governing body which is responsible for designing and streaming the procedure and protocols necessary to supply, administer, and organize the combination of health and social care services. Consumer behavior in pharmaceutical marketing. A consumer is an individual who consumes, particularly one who is, is of specific gender, age, religion, or ethnicity, ethnicity, and who purchases goods for personal consumption rather than for resale. Marketing efforts are focused on the consumer consumptions of services as well as his activities and thoughts. The four P's are the set of consumer incentives, economic changes, technology, politics, and culture are all major aspects in the consumer environment that influence their purchasing decisions. Socio-psychological characteristics of the consumer. Here, the buying behavior of a consumer gets influenced by the external or internal personal influences. External or internal personal influences on buyer's behavior, which are family, personal values, attitudes, and buying habits, have been shaped by family influences. The member of the family play different role influences decision, purchases, and the use in the buying process. Reference group. Reference groups are the social, economic, and professional groups, and a buyer evaluates his and her opinions and beliefs. The buyer can get advice and guidance in his or her own thoughts and the action from such small groups. Social class. We have three different distinct social classes: upper, middle, and lower classes. The consumer belonging to the middle class usually stress rationality, exhibits greater sense of choice making, whereas consumers of lower classes have essentially non-rational purchase and shows limited sense of choice making. Upper class consumers are buy and large brand minded. Psychological characteristics of consumer behavior, and they are motivation, perception, learning, attitudes, and personality. Pharmaceutical market segmentation. Segmentation of a pharmaceutical market is a two-step process. The first step is segmentation is at a consumer level, that is patient level. The second step is at the consumer level at intermediate. Patient consumers or end users. Patients with similar illness fall under the same therapeutic group. Patients can be classified depending on the stage at which the illness or disease has been progressing: acute, chronic bronchial asthma, or patient with the mild to moderate or severe hypertension. Patient according to their age group, pediatrics, geriatrics, etc. Patients can be segmented according to gender, male and female patients. Doctors, those are intermediate customers who are influencers. Doctors according to their age groups, doctors according to their specialty, doctors according to the place where they practice, that is urban, rural, government hospitals, primary healthcare centers, private nursing homes. Doctors according to the types of practice, prescribing doctors, dispensing doctors, etc. Doctors according to their usage rate: heavy users, light users, non users, past users, etc. So, an appropriate definition of a served market is particular one in which you have a combination of customers, products, and services where you have an absolute advantage over all other competitors in the total market. So this is the example which I have taken from the internet. I have pulled out this article and method from the internet. So this is the strategy, how to create a winning pharmaceutical marketing strategy. So this is given by a software which is a private software. A primary barrier to the creation of an effective marketing strategy is often known where to start. So SOTAC SOSTAC is registered trademark is a registered mark which stands for situation, objective, strategy, tactics, action and control, gives marketers six clear steps, and it provides a structure that is easy to remember and explain to others, plus covers all the stages needed to create and implement a marketing plan. So this is the a strategy which is created by a website or by a something software. So this software is a private software and registered software, and to prepare the marketing strategy you have to buy that software, and according to that they will give you the marketing strategy. So in this SOTAG, they are going to see for the situation analysis. In that they are going to think about where are we now, what is the situation, current situation. Next is objective, where do we want to be, what they want to earn in the your marketing process or your production process. Strategy, how do we get there, how to achieve the aim, कैसे करना है. Tactics, what do we need to do. Next is action, who does what, when, and how. And last is control, how do we measure it. So these are the questions which are going to help you to develop and strategy for marketing. Thank you.